When you correct an elevated pubic bone, you have to start with the patient closest to that side of the table. So slide the patient over gently towards you so that about half of her buttock is hanging off of the table. You can keep her from falling just by holding yourself right here. It gives her more stability, and she'll instinctively grab that side of the table so she feels more secure, and that's perfectly okay. When you are correcting an elevated pubic bone, this type of muscle energy technique requires that you take up the barrier in 3 planes. So the hold of the leg is critical, and what you're going to do is reach inside the patient's leg and grab the medial aspect of the ankle so that my forearm is now up against the medial side of the lower leg. I can, from this point now, take my free hand and get right on the pubic bone up top, because this is what I'm going to palpate for my movement. I'm going to take them first down into extension barrier, there's my barrier, back off. Abduction barrier, there's my barrier, back off. External rotation barrier, and I do that by cranking the ankle up toward the ceiling, or the table in this case. And I crank that up till I get my barrier and I back off slightly. Then I ask the patient to pull their left knee toward their right knee, and I resist the motion with 1 pound. So it's a 1 pound pull on the patient's part, 1 pound resistance on my part. And you hold that for 8 to 10 seconds. 7, 8, 9, 10. When they're done, I ask them to completely relax and then take a very deep breath, and I breathe right with them. It takes about 2 to 3 seconds for the muscle spindle to reset itself. Then I take them into their next barrier of extension and back off, abduction and back off, rotation and back off. And again, I call for a 1 pound muscle contraction of the left knee toward the right knee. They hold that for 8 to 10 seconds. 7, 8, 9, 10. Release, nice deep breath. I breathe right with them. Gives the muscle spindle a chance to reset. And I repeat that 3 more times for a total of 4 to 5 times. I then assist the leg back onto the table, help the patient shift over into the center, and then I recheck my work.